Hi, my name is Kim McCarl. I'm Communications Officer with Contra Costa Health Services. So we're here today with Veronica Vega, who's a public health nurse with Contra Costa Health Services. Thanks for being here today.
Thank you for having me.
So I think the question on most people's minds is, does this test hurt?
I want to say no, it no longer hurts. It's a slight discomfort, but it's not painful. 2 weeks ago, we had the nasopharyngeal testing, which went far back into the nasal passage. As of now, we are testing the anterior nasal area with our swab. So it's more of a tickling sensation versus that painful sensation that we had before.
So I show up for my test, and what's the first thing that you do?
Well, the first thing that we do is we need to make sure that we check you in. So we're going to have you drive in. If you've chosen a the drive-in testing site, you'll drive in, you'll meet someone who'll greet you and make sure that you have your appointment, and they'll check your ID. And from there, our nurses will go ahead and start the procedure. We will make sure we are all gowned up. We will wear our PPE, and we will have our gloves on. We'll put on our gloves, or have our gloves on already. We will have our swab in our hand, and we will have our tube. We also have another person who's assisting us, who is our clean person who will be collecting, helping us collect the specimen.
So what are these things that you have in your hand?
So this is the swab that we will actually be using to test. And this is the tube where the swab will go into the tube so it can go be sent to the lab for testing.
So show us what it looks like.
Absolutely. And this is what it looks like.
So it's basically a Q-tip.
It's a very large Q-tip with a foam tip.
Okay, so what do you do with that?
So once we have explained the process, because we are there to guide you and to instruct you and to keep time of the process. So we will hand you the packet. You'll open the packet as I just did, and you will have the swab in your hand. And I apologize, my mask's falling here. So you will take the swab and insert into one nostril, and we will be doing both nostrils. And each nostril is 15 seconds, and we will time that for you. People think 15 seconds is a long time, and if you think about it, it's not, but it could be an uncomfortable process. So just remember, you're inserting, we're guiding, we're timing. You will insert the swab into your nose, just about the inside of your crease of the nose. So just right about here. And you will do swabbing, touching all sides of your nose, on the inside of your nose, for 15 seconds. Again, we're timing for you, so 15 seconds. And approximately 15 seconds is about 15 rotations, full rotations inside your nose. So you can go ahead and just rotate that. And again, we're counting time for you, 15 seconds. Once that's done, that Q-tip is going to go on to the other side, again for another full 15 seconds. And
so
we're
the
timing.
Same Q-tip on both sides?
Yes, same Q-tip, which will give us a good sample to send to the lab.
So then you time the 15 seconds in each nostril, and then what happens?
So we hand back you give us back the swab, and the swab goes into the tube.
What's in the tube?
The tube is a preservative, and this is going to keep this sample nice and healthy for us to send to the lab for testing. The Q-tip goes in here, and we will go ahead and break that off for you. Sometimes these are easy to break off, and other times give it a little bit of a hard time. Then we will take a parafill, and we will seal this. We will seal the cap and the tube together, and our person assisting us will have 2 bags. We insert this into the inner bag, and then we seal those 2 bags up, and we send it off to the lab.
What advice do you have to make this process easier?
I want to make sure that people come in and just feel relaxed and be really proud of themselves for taking that step to know whether they are positive or negative. Because in doing so, they will be participating in making our community better and safer so that we can go ahead and get on with our normal lives.